So welcome to episode 1 of ACL Wise podcast. My name's Tom Jacobs, and today we have Kate Jackson visiting us, a sports medicine consultant, who's going to be telling us a little bit more about the ACL and the state of play in the UK. So let's get into it. Right, welcome, Kate.
Thanks, Tom.
Nice to have you here.
Oh, it's a pleasure.
This is our first proper episode of the podcast I was telling you about, which is about everything ACL injuries, rehab, what the injury is, prevention. The best information we have out there at the moment is different niche subjects in and around ACL. I've known you for a while, but for the viewers' sake, tell me a little bit about your background and what's led you to become interested in the topic of ACLs.
Sure. Well, so my background is a sports and exercise medicine doctor, and for 6 years I was the academy doctor at Oxford United, and I used to look after some wonderful young people there, and they were adolescents getting these type of injuries, and what was really apparent to me was the big impact they had. That's what got my interest going in ACL injuries, and when I was there, we had a really good head of medical department, Amy Cranston, and she was very pro prehab, getting people strong, preventing ACL injuries happening in the first place. Yeah. So that's what really got me fired up.
Yeah. Amy's really, really sensible and really experienced. So she's at Manchester United Women's now.
That's right.
I think.
Yeah.
So for the sake of the podcast, which is going to be largely, I think, clinicians will be interested in this, but then some patients and family members and so on will probably find this sort of subject interesting. I certainly, having ruptured my ACL, I was certainly very interested, and I was going out there looking for information and didn't find loads of high quality information. Of course, that was many years ago, and things have changed more now. But I certainly speak to patients who are really interested in finding more about the injury. But from a better understanding perspective of an ACL ligament, what it is. My question first would be, what is so special and unique about the ACL? So the anterior cruciate ligament is a ligament like any other ligament in the body, right? But we're familiar perhaps with ankle ligament injuries. Why is the ACL different, say, an ankle ligament? So give us a bit of context around that.
Well, the ACL ligament, first of all, it's bigger than any of the ankle ligaments. It does a bigger job. It really is used every day in just our normal function of trying to stabilize the knee when we turn, when we twist. So you don't even need to be playing sport, and that ACL, that anterior cruciate ligament is working hard. And as a result, it's quite a big ligament. It's about the size of my little finger. And it needs to be a big ligament because it's doing that big job. So it's not so much it's different from the ankle ligaments. It's just that it's doing it's having to work harder.
Yeah. So it's got a chunky ligament.
Yeah.
In and around the knee, yeah. But it's not necessarily doing much when we're doing hinge activities. So inline activities, it's not doing as much, right?
It's all to do. Well, let me show you on the knee we've got here. So we've taken away the kneecap,
yeah.
And in there you can see the ACL. That's the pink ligament in the middle there, and it works to stabilize the knee when you're twisting. Okay, so in line, it's absolutely it's not the key role, but when you're trying to twist, when you're trying to turn, it stabilizes the femur above on the tibia below, and it stops it slipping out of place. Yes. And that is what it's doing. Yeah. If you don't have an ACL, when you try and twist suddenly, you get a subluxation, which is where your knee comes out of joint. And if you have other structures injured as well, you can dislocate your knee. So it's really key in that stabilizing when you're doing anything that's twisting, turning, and when you're jumping and you're landing to help stabilize the femur on the tibia, the thigh bone on the shin bone.
Yeah. Okay. So it's heavily involved in pivoting type activities. What about when it gets damaged then? So, I mean, I suppose there's been a lot of attention and hype around ACL injuries in the media in the last few years. Would be fair to say, wouldn't it?
I think so. Yeah, absolutely.
I mean, some high-profile people have injured their ACL, and it comes a lot in the Premier League. So I guess a lot of lay people who are non-medical get a lot of their input from what's happening in the Premier League and other sports, perhaps.
Yeah.
So why is it that we stress about the ACL or the anterior cruciate ligament being injured, and we don't say if someone's turned their ankle and they've got an ankle, just going back to the ankle analogy, why is that not a big deal? If someone says, "Oh, I've damaged my ankle ligaments," and everyone goes, "Oh, poor you, you'll be fine," and why is it more of a stressy thing around the ACL then?
Yeah, a really good question. And actually, if anyone's had an ankle injury, it's horrible, but it's likely to be better within the 3-month mark and you'll be back playing again. An ACL injury, unless you've had it, you really don't have a concept of the length of recovery that's required.
Yeah.
So if you rupture your ACL ligament and you don't have private health insurance and you're wanting to have it managed on the NHS, you're looking at least 12 months, normally 2 years out of your sport and out of any twisting, turning, jumping, landing type of activities.
Yeah.
You can't take part.
So it doesn't heal itself back together again.
If you were an active person wanting to do, for example, football, you wouldn't really cope with a ACL, which is self-healed, okay? Because it's likely to heal in a longer position, which won't give you the same stability. Now, there are clinicians and surgeons who will give people trials of conservative therapy where you let it see if it will heal, if there's a partial tear. But if you're an active person who's doing anything which is twisting, turning, jumping, landing sport, you are looking at needing to have a more stabilizing procedure done.
Yeah. So let's say that the ligament tears. What you're saying is that when it tears, it doesn't just knit itself back together again, like it did before, like it was before.
If you've put enough force through the knee to pull that ligament apart, the ends are too far apart by that stage to be able to knit back together.
Yeah. So they're nowhere near each other.
They're nowhere near each other.
So they can't.
Yeah, it's a practical thing, and also it's to do with the blood supply. I mean, it's getting quite medical, but the blood supply to in that area, and even if they're a few millimeters apart, they won't necessarily heal as well as maybe other ligaments might.
Yeah. And those people where they might reattach together, what's different about them? Do they have some ends touching then, or?
Yeah, so partial tears is where there's some fibres of the ligament that are still intact. Yeah. So that naturally holds it close together and gives the ones remaining a chance to at least stick down. So even if they don't reattach to each other, which is a really big ask for a ligament, they can stick down and eventually they'll remodel and you'll get a ligament of sorts.
Yeah. So the velocity of the original injury will have an impact. I mean, how much force was involved, about whether they just go ping and they end up nowhere near each other, or whether they are partially torn. Or I've also heard you mention before about when the ligament, or the surgeons talk a lot about when the ligament end attaches itself to something else, maybe the joint capsule or something else. So that can happen as well and provide some sort of partial stability, perhaps in some cases. But what you're saying is that for the athletic population, the current standard practice at the moment, certainly in this country, is that most will, to get good stability back, will end up with an operation.
That's correct. In this country, the majority of young people or of any age, if they want to go back to a twisting, turning, jumping, landing type of sport, are very likely, if they choose, to have an operation to provide that stability. Okay. Yeah.
And is that part of the reason that the recovery is so long?
Well, the recovery is long anyway. So if you choose to have conservative treatment, which means not having surgical intervention, you're still looking at a 12-month recovery, unless you're an elite athlete with a lot of physiotherapy and strength and conditioning support around you. When you'll read in the newspaper, at elite level, sometimes they get back at 9 months, but that is not realistic for the majority of the general public who have this type of injury.
And that's because of waiting lists or lots of other things?
It's just the time it takes for your body to recover from that operation, from that injury, and for you to strengthen up sufficiently to be able to safely return to those type of activities. Okay. Yeah.
Is that different then for younger people? You've worked in some elite level academy settings. So how is that different for the younger population? Is it different?
Having an injury per se?
Yeah, the injury process.
Yeah, I think so. No, I think the mechanism of injury can be identical whether you're 13 or 30, but the impact of the injury is for sure has different nuances. So it's awful for a 30-year-old to have an ACL rupture. It will still take you out of whatever you're doing. But the chances are at that point, unless you're an elite athlete, if you're an amateur athlete and you're 30, you're probably going to work. You have other interests. You have other structure to your life. When you're 13, for example, you're a sporty kid, then sport is part of what defines you in a way. It provides you with your self-esteem, with your social group. It's good for your mental health and so on. And so when you're injured and you're taken away from that group and you don't have the ability to take part in sport for 12 months, 24 months, that has a big impact. And in my opinion, it's not just a physical, it's a psychological impact and it's a social impact, which I think is more pronounced in a teenager than it would potentially be in a mature adult.
Yeah. So other than the 2-year period you talked about, if they're, for example, a surgical case, and the obvious impact it's going to have on someone's life.
Yeah.
Are there any long-term impacts of this kind of an injury?
Yeah. So it's worse if you have concurrent injuries in the knee, for example, a meniscal tear at the same time. But anyone who ruptures their ACL is at increased risk of osteoarthritis in the long term. And that, as we know, has an impact on your quality of life as you get older.
And we're talking when they're sort of 70, 80. It's like an old person's
Well, not if
thing.
you're 15. So if you rupture your ACL in your teens, then a large proportion of people will get osteoarthritis 15 years or so after their ACL rupture. So if you rupture it in your teens, then by the time you're really quite a young adult at 30, you are going to start having symptoms of osteoarthritis.
Even earlier than 30, maybe.
Potentially, yeah. I mean, it's a big impact, right? Yeah. And it's a big impact on the individual for sure, and it's a pressure on our National Health Service as well from an economic point of view.
Yeah, so there's some studies that you're perhaps referring to about A&E attendances and the proportion of A&E attendances that are down to sports injuries and so on. So that has a significant impact on our front resources, doesn't it? So if for children, you're saying that it's going to have a bigger immediate impact of the injury and its burden on their lives, and there's also this early onset arthritis bit. So there's two things to consider then in the mix. What about their recovery? Is that different if they are juvenile and their chance of re-injuring? And
well, so there's good evidence that if you're a teenager with a rupture, there's a significantly increased risk of re-rupturing.
Compared to adults?
Yeah. And the other aspect of pediatric ACL ruptures, children versus adults, is that the surgery is more complicated. So that's two reasons why trying to avoid ACL injuries in those younger age groups is really key. And the impact is greater.
In simple terms, why is the surgery more complicated in youngsters?
In simple terms, a growing bone hasn't yet fused. And what that means is a bone in a baby grows, and it grows from the ends.
Yeah. So if this is the femur...
Yeah. They'll have little lines across here. They're growth plates. It's called their growth plates.
Yeah.
And from when they're a baby until different ages, depending on the bone, through their teenage years, those eventually, they carry on growing and eventually they fuse. At that point, the bone stops growing. And that is when you've got your mature height and your mature size from a bone point of view. Yeah. So the surgery involved in repairing an ACL involves being very close to those growth plates. And that's dangerous. And the surgeons are very good and very aware of this. But there's always a risk if you're operating close to a growth plate and interfere with it, that it interferes with the growth in that bone.
Yeah, so you could get growth arrest.
You can do, yeah.
Or you could get, an asymmetric development of that bone, perhaps.
Absolutely.
Or different things like that. Okay.
Exactly.
So surgery is more involved. Chance of re-injury, again, if you're not an adult, if you're under adult age, is much higher.
Yeah.
So that's a problem then. Yeah. So this group is a much more vulnerable group compared to the adult population.
I think so. I think there's more to consider, and there's more reasons.
It's more complex.
It's more
perhaps.
complex.
Yeah.
Yeah. Yeah.
And do you think that that means that we should manage how we treat that population different to the adult population?
No, I think we should do our, be as do the best we can for both groups.
Yeah.
Does it look different? I think there's an argument that there should be more support for teenage ACL ruptures from the psychological point of view, for the reasons I said.
Yeah, yeah.
And I think at the moment that lands heavily on physiotherapists. ACL ruptures usually present to A&E. Well, A&E can't follow up. That's not their role. So then they have a diagnosis, and they're referred to the physiotherapist. And the physiotherapist is their key worker, if you like, through the process of rehabilitation. Even if they go and have an operation, they then come back to a physiotherapist and have to work really hard to get to fully recover. So I think that's a really key role, which isn't the physiotherapist's role, but I'm sure experienced physiotherapists will say, yeah, it does end up being part of your role, because young children and teenagers that suffer this injury have a psychological impact from it.
Yeah.
Yeah, so I do think there is differences and nuances.
So ignoring the obvious challenges that the health system has in the UK at the moment, in an ideal world, how do you feel it would work best for, let's say, a teenager who's had an injury like this? How could you see that rehab process working?
That's a really good question. Well, there's some interesting research going on around the use of technology and self-directed psychological support to try and support people with ACL ruptures through the process, because it is long, and physiotherapists is not actually their role, even though I'm sure holistically they would like to support in that way.
Sure.
Those type of apps are being trialed to see if they can just help support with that psychological aspect.
Yeah.
So I think that would be really key. To be able to...
It's easier to scale that, I suppose, isn't it? And it's
it
a bit
is.
more cost effective.
Yeah, I think so. And, of course, I think it would be part of GP and physiotherapists and orthopedic surgeons, part of their training to understand those type of apps, so they can really talk to patients about them and say, look, this is it's a hard run ahead of you. That's the reality, but we're going to help you through it. And not just by giving one goal and then hoping that's enough. It's by really thinking about every aspect, about loneliness, feeling isolated, feeling depressed, through lack of activity, loss of contact with their teammates and so on. Really trying to think it through.
And then possibly also the end stage rehab process. I'm just thinking about my own experience of an ACL recovery. And I had really good management under the NHS in Reading.
Fantastic.
And Debbie Burden was the physio who was rehabbing me at the time, and she didn't take it easy on anybody, but that's her style. But I would say that at the end of the process, I felt a little bit left to kind of just go get on with it. That would be my only point. And I felt very vulnerable in my leg. I didn't do a psychological readiness score or anything like that. I didn't think there was so much the done thing back then, but I felt a vulnerability in going back to sport. And that was actually the most difficult part of the process for my rehabilitation journey, was trying to get back into football and tennis and volleyball and other sports after rehabbing.
Yeah. That final step.
Yeah.
From your clinician, physiotherapist saying you're ready to go, and you actually have to turn up and do your first match or your first training session.
Yeah. I felt like, I'm not sure I'm ready for that. Thanks very much.
Yeah.
So I felt like there was this, the staged process. It got better, and then there's a lot, and there was this chasm between where I was and where I knew I used to be when I was playing sport. And maybe we don't do as well as we could do in that stage of the process.
It's a really good point. And we know that people recover from their ACLs, but not all return to their sport at all, which is devastating on a whole number of levels. Physical activity is key to keeping us all healthy. We want people to be doing physical activity that they enjoy. Because if you're doing something joyful, you're going to stick at it. So people not to get back to their sport. And of course, they might replace it with something else. but they may end up doing nothing, and that's a tragedy. So I think that I don't know what the answer is, but I think that's something to think about.
We know that this is a challenging injury in team sport and in other sports as well, but many of them happen in team sport, right? And there are things that we could be doing better. In our country, thinking a little bit about the population that we have and the natural process of rehabilitation, operative or non-operative, and the bits you've described, do you think the UK as a country, we could be doing better in any particular area when it concerns ACL injuries or prevention or how we manage this type of a problem? I'm thinking also in relation to physical activity, because as clinicians, we and people who play sport outside of work, right? We promote sport. We understand the benefits, obvious benefits from a population health perspective. Do you think the UK could be doing better? And if so, in what way?
Well, we already mentioned the psychological support. I think that's probably missing in a formal way.
Yeah.
In a more structured way. I think that's currently missing. That would be wonderful. I'd love to see people feeling more supported throughout their rehab process. The main thing we should be doing is trying to stop these injuries from happening in the first place. There's a big push for prevention across all fields of the NHS. And I think musculoskeletal medicine is no different. We should be looking wherever we can at how to prevent injuries.
Yeah. So a certain amount, I mean, perhaps the skeptics would say, well, injuries are going to happen, Kate. Like in sport, injuries happen, right? So do we not need to just accept that?
I think we do accept it. And certainly, even when we try and prevent injury, you accept you're not going to prevent every single one. But if you can do simple things that aren't costly, that are easy to learn, that make a difference, why wouldn't you? To me, that's a no-brainer. Why wouldn't you?
And I suppose there is a big difference between someone who pulls a muscle. That's an injury that we can all kind of accept and live with and move through. And this kind of an injury where the implications, like you've mentioned already, are quite significant, I suppose. So we're not just talking about a one-off episode that's going to be someone's just going to get over. There are implications potentially for re-injury and then their health for their body later in their life and those sorts of things. So I can see how perhaps you're thinking that prevention is actually a bit unique with this injury.
Well, certainly this injury deserves preventing. I'd put it that way around, because I think there are probably other injuries that also deserve preventing, like concussion, for example. But yeah, it's worthy of preventing. And I think the skeptics, I think that's my natural standing, is to be quite skeptical of things. I'm a questioner. But I think if you'd ever sustained an ACL rupture, you wouldn't be skeptical about trying to prevent it. And that is the problem with this injury, is that when it does rear its ugly head, the person who has it thinks, I never want to have that again, and I don't want anyone else to go through this either. So
with the work you're doing at the minute, obviously you're still doing some doctoring and you're still doing teaching and things like that. You talk about prevention. What is on the cards in the future, next few years, do you think? Being involved in this sector as you are, what do you think we are going to be seeing in the UK?
Well, at the moment, there's momentum to try and think about how to prevent ACL ruptures from a national perspective. There are various strategy meetings going on around the UK at the moment. There's one next week in London. And what we're trying to do is to think how to embed ACL injury prevention into the UK in a way that is easy for people to engage with, basically, but that makes a difference. Those two things are both wins, win-win.
And without going into detail, what does make a difference?
Well, at the moment, we know that in improving your strength and conditioning around the knee and around the lower limb and your core muscles makes a difference. So that's where we're putting our efforts at the moment. We're keeping a close eye on the role of hormones in female ACL injury. Lots of research it is going on, but we don't know the answer to that at the moment.
Yeah, well, it's not conclusive with the
It's
hormone
not
thing.
conclusive, yeah. So it doesn't mean it's not relevant, but right now we should be acting on what we do know, which is that doing a strength and conditioning program to stabilise your knee to the best of your ability and keep it in a good position can reduce ACL injuries by 50%.
So what would be a good resource for people if they're interested in finding out a bit more about what you've just been describing?
Well, the best resource is to go to Power Up to Play website, which is www.poweruptoplay.org. And from there, you can look at a simple warm-up, which is generic. If you're already doing warm-ups and you want to take it up to the next level, there are signposting to the football-specific warm-up, which takes a little bit longer, and to the rugby warm-up.
The 11 plus.
The 11 plus, yeah. That website will really get you started on the road to introducing this type of injury prevention.
Brilliant. Great. Well, thanks for coming in.
No, my pleasure.
Until next time.